Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Dementia. So that's 15 ways, science-based ways of reducing your risk of dementia. And they start with number one, try a plant-based diet.
Wow.
I knew you'd rejoice, Darryl.
Sounds familiar to me.
Two, exercise regularly. They point out that all the things that we know that are good for health in general are good for preventing dementia, and that there's no cure for dementia. So best do what you can to prevent it. Third is to get your vaccinations. There's many studies that demonstrated that you have an increased likelihood of getting dementia if you don't get the vaccines that you're supposed to get. See what happened. Number four was try a daily multivitamin. Interesting that there's evidence that multivitamins slow the progression of dementia after the age of 60. Fifth was something that people we don't know how to avoid. Avoid air pollution. Where you live is probably one of the biggest factors in terms of how long you live and the quality of life that you live. But nevertheless, avoiding air pollution is an issue. And of course, with all these wildfires and stuff, this becomes more and more difficult. Then protect against traumatic brain injury and falls. Do everything you can to protect your head and protect yourself from falling. They emphasize those of you who drive bicycles and motorcycles to wear your helmets. And they even talk about the football players. Of course, they wear helmets. But then something that we've talked about many times is save your hearing. We've talked about the importance of the fact that this results in the need for hearing aids. Then maintain your social connections. Point about how social isolation is one of the biggest problems associated with Alzheimer's and dementia. And then try to reduce your loneliness and any social isolation. Then number 10 is monitor your blood pressure, blood sugar, and cholesterol. These all contribute to increasing the risk of dementia. Number 11 is get a good night's sleep, pointing out insomnia and daytime sleepiness are associated with a greater risk of dementia. Then reduce alcohol intake. Some would say eliminate it, but this article says reduce alcohol intake, stop smoking, avoid sleep medications. And number 15, John Tatum would be pleased with this, do crossword puzzles and do activities that engage your brain. And then I add number 16, which is meditation, which most people don't include in their list, but I think they should. Any comments about these 16 science-based ways to reduce your risk of dementia, with the acknowledgement that we don't have a treatment now. We don't have any treatment, no cure for it, but an ounce of prevention is worth a pound of cure.
I have a comment about the air pollution. Where you live is really important. Urban environments contribute a lot of air pollution, but there's pollution inside of our houses. Like I think last week we talked about oil-based cooking. Be sure to turn on the stove fan or the hood exhaust. But I had a thought because I know some earlier group sessions we talked about um, gas burning stoves and ovens. And so I did a search on that, and that adds to air pollution with what they call VOCs, volatile organic compounds. So the thing I didn't think of, the recommendation is, if you've got a gas stove, whenever you use it, turn on the hood fan before you light your gas burners. Leave it on the whole time you're cooking, and leave it running 15 minutes after you finish cooking, after you turn off the burners, because that does contribute a lot of air pollution, can add to dementia. So, it's little simple things like boiling water, or if you got some tea just simmering on the stove. I didn't think you needed a hood fan on for that, but apparently you do. So, in my house, we've got the hood fan going on quite a bit.
Thank you for sharing. Any other comments?
I had a question about radon being a household menace, and the other one is your fireplace. What about your fireplace?
Well, radon speaks for itself. We've talked about that many times, but I don't know. They didn't. I haven't read anything about fireplaces. Anybody want to comment on that?
Yeah,
Anybody use fireplaces?
yeah, I had to use mine uh, a bunch of times this winter and early fall. And when that flue is not fully open, that smoke can get all through the house very quickly. It's we're sensitive to that stuff. So I think it's I've never seen any statistics about it, but I think it's probably probably dangerous.
And that brings to mind, uh, maybe I missed it, but was smoking on the list?
Yeah,
Okay.
stop smoking. Yes.
All right.
Here's what AI has to say about fireplaces. It says, yes, fireplaces, especially those burning wood, contribute to air pollution, releasing pollutants like carbon monoxide, particulate matter, and volatile organic compounds, impacting both indoor and outdoor air quality. And it also says that up to 70% of the smoke from chimneys can re enter nearby homes.
Mm.
And we're going to have one of the papers that talks about the unknown area that contributes to poor health being where you live. And we are situated in locations that are associated with pollution. And so, and that's no accident. That has been done deliberately, and we suffer the consequences.
Yeah, to Darrell's point, that the neighbor's chimney, I could tell when they're using their fireplace because I can smell it next door. It's
Mm.
just like in the hood, if somebody's in the backyard barbecuing, and they didn't talk about it, you can smell that throughout the whole block.
Okay. Any other comments before we move on to the articles?
Yeah, that used to be a good smell. Somebody barbecuing, you say, I'm going over to their house.
Okay. Okay, let's go to the articles. You have enough of them. Uh, this this was a surprise to me. The fact that chewing gum contributes to the microplastic ingestion that we've been talking about for some time, and how that is contributing to our ill health. And lo and behold, just chewing gum release a potential. Here they say 637 particles per gram within the first 8 minutes, both natural and synthetic gums. This is frightening, but this just adds to the list of the many items that are associated with microplastic release, and how this is contributing to our diseases. And there are multiple diseases. The thing that is most alarming, though, is that we have no idea of how to combat this problem, which is growing and growing and growing. And so it appears that we have no protection other than to avoid as much as possible. But saying that is like uh, blowing to the wind because there's so many different ways that microplastics are released upon us. And so there's a lot of work that needs to be done in this area to try to decrease the many ways in which microplastics are damaging us. Any comments or questions? John Buchanan.
Yes. So a couple of weeks ago, we talked about the app that you can install on your mobile device called Beat the Microbead. I wouldn't have ever thought to check the bubblegum wrapper. Isn't that something? You
Yeah, yeah,
have to
yeah. Well,
check your food. You wouldn't think that it would be in, golly, the natural and the artificial gum.
yeah, right. So, any other comments before we go to the next article? It's frightening, but
Yeah,
yes, Aaron.
I did have a quick question though. Did anybody else install that app? I know Darryl did. Did anybody else do that? It's a free app. It's called BTMB, Beat the Microbead.
Yeah, well, hmm. Okay. Thank you for sharing that information.
Daryl's hands up.
Well,
Yeah, Darryl. Go ahead.
Yeah. Okay. I read a pretty extensive article, and I should have sent it to the group session. And it was saying that um, consuming anthocyanin-rich fruits and vegetables might help mitigate the negative effects of microplastics in diet. And those anthocyanin are the brightly colored fruits and vegetables like blueberries, blackberries, raspberries, red cabbage, eggplant, red onions. But the tip for what is anthocyanin is the brightly colored red, purple, blue hues in fruits and vegetables. It can be protective against some of the negative effects of microplastics.
did they mention peppers? Peppers are bright color, some of them.
Um, well, okay, I'm just going through the list, and peppers aren't mentioned, but the berries,
Okay.
grapes, plums, pomegranate, blood oranges, acai berries, black rice, those are the fruits. Vegetables are red cabbage, eggplant, red onions, purple cauliflower, purple potatoes, purple corn, red radishes, and black carrots.
Thank you very much. Okay, let's go to the next article. While we await efforts to address the microplastics, which they say in oceans may increase the disability risk among the coastal populations uh, because they had higher levels of microplastics. But of course, we know that you can see the impact of the high microplastics on many aspects of thinking, memory, mobility, self-care, and independent living. And that's only because we haven't really uh, delved into the many ways in which the microplastics are killing us, so to speak. And so we've got a lot of work to do to really find out and how to prevent the impact of these microplastics on us, because it's clear to me that uh, we have we haven't even begun to get to the tip of the iceberg of the microplastic problem, and so we've got a long way to go. We're just beginning, and we haven't even identified how many ways in which these microplastics are affecting us, and so we can be aware of it and keep it in mind as research identifies ways to identify and eliminate uh, microplastics. But the only thing that is problematic is we have an increased greater reliance on plastics, and that is scary. John Buchanan?
Yes, you know, we are thinking about the ocean. You think about the ocean, it's so big, most of the planet is covered with ocean. And how could microplastics affect the ocean? But what happens is that fish, even the tiniest fish, might and do mistake plastic for food and they eat it. And then when we eat seafood, we're eating the microplastic indirectly that the fish have eaten. So this is a very serious issue. Even though we think that the ocean is so big, it couldn't make a difference, but it really does, especially near the source of those microplastics, which is the land. Thanks.
Thank you
Yeah,
for sharing. Yeah,
it's the coastal regions.
okay. Next article, please. This is an article that suggests that uh, depression, which is such a huge problem in this country, uh, is treated with antidepressant. And some of these antidepressants are associated with sudden cardiac death. And this is one of the first studies that people who use antidepressants for 6 or more years uh, have a high sudden cardiac death rate. And so this is one of the fearful articles that talks about the fact that, of course, depression is associated with many negative aspects. Suicide is one of them. And the antidepressants, which keep would decrease the rate of suicide and the many other side effects of depression, may contribute to sudden cardiac death. So a this was identified in Denmark. Whether it's operative here or not remains to be seen. But anyway, this is a European finding that we need to look at here to see if there is the same association. Interesting that we recognize how severe disease depression is, but yet in some instances the side effects are more than we were bargained for. One of the things that you could do is to get the EKG to see if you have any Q2 interval prolongation, which is what may be a finding, but we need to do much more research on this to find out how important this is. This is identified in the European population, but not yet in our population. Okay, those of us who are on antidepressants, just uh, wait for the research to show whether this is operative with the antidepressants we use here in the United States, or is it just in the antidepressant that they use in Europe. Uh, so you shouldn't stop taking your antidepressants because the negative consequences of that are great as well. Okay, let's go to the next article. This is a sad commentary that avoidable deaths are rising in the United States while every other country is declining. Uh, and it's just really hard to conceive that we'll continue to do worse in the preventable death category. And of course, fatal drug overdoses is completely preventable. So as long as we have such a drug abuse problem in this country. It's likely to remain that way. Then, of course, all the accidents we have. And then, of course, many people regard the fact that our cardiovascular deaths have not decreased, in spite of finding ways to manage hypertension and hypercholesterolemia. We still have not had a reduction in the cardiovascular deaths. So that preventable mortality is something that
I'll try.
our public health should target. But so far, there's no evidence that we're doing a good job at that. Of course, many believe that RFK, with his ideas, will uh, be addressing these issues. Time will tell. First, you have to find out who's left to die after all these contributory factors to death that they're doing are put in place. All these reduction of Medicare, reduction of Medicaid, and all these other things they're doing, firing all these people and all that stuff. How does that contribute to the death rate? That's not factored into it, but maybe it should be. Any comment on this, John Buchanan?
Yes, I just heard Kennedy on the radio yesterday. He sounds terrible. How could somebody who's in charge of health be so unhealthy sounding? I mean, he sounds like he's about to die for real. Um, and preventable mortality, the deaths due to the latest it's not called an epidemic yet, but it's 600 deaths and I think two or three children died recently from the outbreak in Texas,
Measles, yeah. Mhm.
and
Yeah,
and he has
another unvaccinated child just died, apparently.
right, and he has not said that you should get it. You know, it's bizarre to me. Anyway,
Any other comments on the sad state of affairs that we find ourselves in?
He doesn't have a medical degree either.
Okay, let's go to the next article then. Peripheral, we're finding that the GLP drugs are good for most things, and now we're finding they also reduce peripheral artery disease. Well, of course, that is more common in diabetics, uh, but it also happens to people who are not diabetics, particularly smokers and people. But the list of ways in which the GLP drugs are effective just keeps going up and up. And this is something else, peripheral artery disease, which affects people as they walk and they have pain in their calves because of the poor circulation in the legs. And so this GLP drug is now identified as being positive in terms of increasing your ability to overcome the peripheral artery disease. Not only in diabetics, but in others. Yeah. This is a disease that peripheral artery disease that causes the need for amputation, and particularly in people of color. And so it's something to keep in mind that certainly for the diabetics and those who are not diabetics, that this is a treatment that can be helpful. Any comments about this new observation?
I had a question about whether this drug will help with strokes.
Well, the implication is if it affects peripheral artery disease and it affects the cardiovascular system, which it does, that it is likely to perhaps, but that study has not been done regarding stroke, so we have to wait and see on that. But there's no data that is presented yet that particularly uh, singles out stroke and the GLP drugs. Not yet, anyway. So, any other comments or questions about
I have a
this?
question, Dr. Salmon.
Yes.
It's just interesting because I'm looking at the closing comment on your presentation when it says that this trial could be a game changer because of improving quality of life. And then it goes on to talk about there's even potential for improving outcomes such as heart attacks, strokes, and blood pressure and weight. And just yesterday, I had some challenges with my high blood pressure readings. And I'm on losartan, a small milligram once a day. But on yesterday was kind of a different change for me and this lane that I'm in. So, for example, yesterday morning, I got up and I took my blood pressure because my vision was clouded. Put on my reading glasses and my vision was still clouded. So I went and got the blood pressure machine and it was 196 over 97.
Wow.
And I let, uh-oh, that doesn't sound too cool. So I waited a while, and that was at 11 o'clock yesterday morning. So I waited a while and I took it again at 3 o'clock in the afternoon, 155 over 93. And I took it this morning, 196 over 82.
Mm.
So on yesterday, I did go to my eye doctor because my vision was blurred. And I said, what is this? And I went to her and, did all these eye exams, and, the eye drops and eye da da da. And I said, well, you need to take my pressure. And she did. And when I had it with her, it was in the 190s also. And so she, of course, recommended that she asked if I was on any blood pressure prescription. So I told her, yeah, I was. I'm not that I was, but I told her, yes, I am. And she kind of, asked me about that, how long I've been on, maybe the beginning of the year. And again, it's losartan. It's only 50 milligrams. So she suggested that I get in contact with my primary care doctor this morning.
Are
And
you already on antihypertensive medications?
well, I've never had in my life, but high blood pressure does run in my family. And earlier
Oh,
this year, my doctor put me on losartan, only 50 milligrams, once a day by mouth.
mm. Yeah,
And
so
I've been doing that, but this blurred vision thing yesterday out of nowhere and
yeah,
the high reading was kind of game changing for yesterday.
yeah, it's clear that you have hypertension that needs to be treated aggressively uh,
Hmm.
because those pressures are dangerous. And I'm glad that you picked it up, and now it's important for you to get medications that will reduce uh, your blood pressure to a point where it's in the healthy range, which is, of course, less than 130. So,
Yeah,
uh,
that's what I was used to. That's
yeah,
what I've been
yeah.
used to. So I guess I just need to go ahead and reach out to a cardiologist.
Well, you need to find a doctor who takes care of high blood pressure that can deal with it right away because those pressures are too high and they're the kind of pressures that lead to strokes. And
Yeah.
so the sooner you can get to a doctor who will start treating you for your high blood pressure, the sooner the better.
Mm, okay.
And we now have
Recommendations.
we
So,
now have so many medications that treat high blood pressure that
Mhm.
without any side effects. So that
Oh,
uh, so you need to find somebody who's a hypertension expert to help you overcome this this condition that is so prevalent among us.
yeah.
Uh,
Yeah. So, high
yeah,
blood pressure specialist.
yeah.
Thank you.
Okay, and the sooner you can reach out to that doctor of your choice, the better.
Oh, absolutely. Absolutely.
Thank you for sharing.
And
Thank
thank you, John, for reminding me about the meeting today. Tatum, that
you.
is.
No
Okay,
problem.
any other comments? Okay, let's go to the next article. It's very clear now that bariatric surgery is very effective, cost-effective for patients with obesity, as well as cirrhosis. Uh, it also is effective for diabetics. It's interesting that they didn't mention that because I've had a number of patients who actually have had their diabetes cured by bariatric surgery. Uh, but this is an article that talks about the fact that bariatric surgery is actually a treatment for cirrhosis as well as obesity, and that it may keep you from going from liver disease that will lead to the need for liver transplant to actually having it corrected by bariatric surgery. This also has been uh, associated with the GLP-1 drugs as well. Uh, Formerly, there was no real good treatment for um, non non uh, non-alcohol associated liver disease. And now GLP has been associated with actually reversing uh, non-alcoholic liver disease. So we we're in an era now where a condition that was formerly untreatable now has become treatable by two different mechanisms. Bariatric surgery is one of them. GLP drugs is another.
Dr. Counter, what is bariatric surgery? What does that mean?
Okay, that's surgery in which the stomach is narrowed or bypassed in order to uh, keep you from eating too much. It also uh, allows for the production of a hormone that takes away your appetite and decreases the craving for food. So bariatric surgery is the surgery that uh, affects the gastrointestinal tract in such a fashion that just the size of your stomach is markedly decreased and uh, the capacity for gastric storage is cut in half or two-thirds. And so that's what bariatric surgery is, a surgery that cuts the storage capacity of your stomach from 100% to about 30%, and also decreases your ability to eat a large amount of food, and uh, that it is there are a number of surgeries they do. They have one surgery that it just cuts the stomach to from whole to a third. There's another in which they bypass the stomach, uh, and the food goes into the GI tract, and the hormones that cut the appetite are very effective. So, so bariatric surgery is the surgery of the GI tract that reduces the storage capacity of the stomach.
Thank you, Dr. Counter. What is this paragraph here about the costs involved?
Say again?
this paragraph here, accounting for costs.
Well, actually, most of the surgery is covered by insurance. So that, as a matter of fact, Howard has a very excellent bariatric surgery department, and they have identified that since uh, Obamacare, uh, many of the people of color are now covered by insurance, and they have had a dramatic improvement in their lifespan because of the bariatric surgery that can now be done. So that uh, now, of course, there is the expectation that with the Trump regimen that they will cut out all of the advantages that have come from uh, Obamacare. But until that happens, there's much evidence that people of color now are covered for bariatric surgery. Any other comments or questions about this? Oh, Darryl, go ahead.
Yeah, I had a comment about, well, the underlying conversation is about obesity in the United States, and obesity rates are for adults. Black adults have an obesity rate of 50%. Non-Hispanic Hispanics have an obesity rate of 45%, and non-Hispanic white adults at 42%. Um, that's extremely high, and just for the whole
Wow, is it
country.
ever?
I'm talking about adults, but it's really critical for Black adult Americans at 50%. So whether it's diet, surgery, GLP drugs, we've got a lot to work with our obesity rate.
Thank you for sharing. Couldn't agree with you more. John Tatum?
Yeah, are there any similarities between bariatric surgery and ruin bypass surgery?
That's the same. That's the same thing. That's the type of bypass surgery. There are three or four types of uh, bariatric surgery. Roux-en-Y bypass is one of them, and that is associated with uh, cutting the stomach capacity in half and bypassing the stomach as well. That's a type of bypass, Roux-en-Y, special type of bypass. Any other questions about bariatric surgery or the gastric bypass, which is a synonym? Carol Tatum and then Dr. Perez.
Um, the adverse effect of that, well, maybe it's just odd. I had one cousin that had that, and they went back to their old habits of eating a lot and enlarged the stomach again, and then they had more problems than they did before they had the back by whatever that surgery is. And also, I have one other friend that had that surgery, and then they started after. At first, they were losing weight, and then they started gaining it back again. Did they mention this about it?
Well, that they have now done many studies that demonstrate that the treatment that is more likely to be associated with reduced weight gain is bariatric surgery. Yes, there are some people who are resistant to the treatment, but more people are have a positive outcome. Yes, there are some who revert back to their normal habits, but probably about 70% of the people are improved by it for short term and long term. Dr. Perez?
I think one of the things that's critical that has been said is the fact that uh, options for so much of our community remain the same with or without bariatric surgery. So if the only place that you're having 2 to 3 meals a day is McDonald's, then that's what's going to happen. So obesity is a community wide issue. And because under the age of 16, I don't think it's approved. Many of I know we're moving to make sure that GLP-1s are available for adolescents, but it's these habits and environments in which adolescents are in that lay down the framework for which obesity and all of the consequences associated with it continue. I think everybody who undergoes bariatric surgery should be a part of the transplant support group. And then we could be assured that they would maintain normal weight. But those things don't happen. And so that's why this group and this philosophy is so important.
Any other comments about this disease? When you have women above 40, 50% and above are obese, we have a special problem with that. And I think the data that Darryl shared are frightening to say the least. Any other comments or questions?
Could you comment a little bit more about this the sleeve, the biband sleeve?
Well, the sleeve they just cut the stomach and from 100% to 30%. That's where sleeve is. And the banding, they all do the same thing. They reduce the capacity of the storage capacity of the stomach from 100% to about 30% or less. And that's what the sleeve does. And they have a number of ways of doing it. One is the bypass, one is the sleeve, and one is just banding the stomach so that storage capacity is gone.
All righty, thank you.
Okay. This is a surprising article that talks about the 6 pathogens that cause 10 million foodborne illnesses, and norovirus leads the pack. And of course, norovirus is the virus that the alcohol does not kill. And so hand washing becomes critical for the eradication of the norovirus. And then, of course, these others, they pale in comparison to norovirus, although all 6 of them together are responsible for 10 million disease entities. And they list them in order here with norovirus, emphasizing once again the importance of hand washing. And even though alcohol is good and knocks out many of the other viruses and bacteria, it does not knock out norovirus, which is the biggest problem associated with vomiting and diarrhea at the same time, and cause for a lot of disease and hospitalizations. The other foodborne pathogens are identified. Salmonella is well known, but even that is not as much as the Campylobacter species. And then the other ones, E. coli and Clostridium listeria, are known as well.
Dr. Kelly, I've never heard of the Campylobacter.
Okay, all right. I think that's the only one that you probably haven't heard of. The others are well known, but Campylobacter. But 1.9 million is not small. So,
What about Clostridium?
yeah, of course. Yeah, and E. coli and listeria. But yeah. Any other comments or questions about foodborne pathogens?
My question is neurovirus. Uh, the word neuro, that referring to the nerves over the whole body?
No, has nothing to do with nerves. That's just the name of the virus.
It's Noro, John. Noro.
Noro.
Neuro.
Okay.
N-O. All right. Dr. Perez?
It's not for this article. I just want to ask you something about the one that we just passed as it relates to bariatric surgery.
Go ahead.
Um, Bariatric surgery is the gold standard for obesity, over 100 pounds.
Well, morbid obesity it is. Yes.
Okay.
That's
I just think that that's an important an important realization for our community to see, to embrace, and to move forward with.
Thank you for sharing. Any other comments? You see how it ends with the norovirus comment, which essentially the flu and norovirus were particularly bad for us this year. Okay, let's go to the next article. Shingles is awful, but there's another reason to get vaccinated. It may fight dementia. In other words, a vaccination cut the risk of developing dementia by 20%. So it's another reason to get vaccinated against shingles. But if you're over 50, all of the people that I've talked with who are over 50 who got shingles were particularly emphatic about the pain of shingles. And so the need to get the virus if you're over 50, to get the vaccination if you're over 50 is compelling. And it's presumed that if you're over 50, you have the virus. The only question is, will it be activated? Dr. Perez?
My brother, who's had the virus that causes AIDS for over 30 years, had shingles, and he said of all of the complications he has had associated with HIV, shingles is the most devastating. He said he cried out for death. It was so bad. So I hope there's no one who's where there's not a contraindication for you to get shingles that hasn't been vaccinated. I thought the vaccination would have been more painful than any other. It was not. And the whipped cream on top of it is that it diminishes dementia by 20%.
Thank you for sharing. Any other comments? This talks in detail about how to do it and whatnot. Darryl?
Yeah, I had shingles. It's so bad it can make you lose your mind. You don't have to wait to get dementia later. You can just be uh, crazy right on the spot with because it's like it's so bad. You wish for death. Death would be a whole lot better than,
That's what
especially
my
like
brother said. Yep.
yeah, if you don't get treatment right away, and my first shingles attack was misdiagnosed, and so my treatment was delayed for about a week, and I mean you can't sleep, you can't get comfortable, it hurts, you just want to end it all.
Wow.
I got a testimony. I'm
Great.
also a former shingles patient. Lord Jesus. And all of my years, I never remember saying, Lord, I'm just ready. Just take me on with you, Lord. Just take me home. Just take me home. So
Wow.
I am a witness. It's inexplicable. You can't explain the pain, the agony. It's gruesome. It's like a curse from the bottomless pit somewhere. So yeah, I'm the third testimony about shingles.
Wow. Mr. Tatum, you're next.
Yeah, I wanted to ask Dr. Callender, what is the comparison to sickle cell, the pain? How do you compare it with sickle cell pain?
Well, you'd have to ask somebody who has sickle cell because I don't know. I, you- you're asking which is worst, uh, 9.9 or 10, and I don't know the answer to that. I guess you'd have to ask a patient who has sickle cell disease and who's also had shingles to be able to tell which is worse. Although I'm not sure that the pain, the agony is so intense that those sickle cell patients have to have uh, uh, pain medication, the ultimate in pain medication. Uh, but it's kind of asking which is worse. Uh,
The devil or the deep blue sea?
yeah, okay. Or being pregnant and delivering a baby, or having uh, kidney stone. And all of those are still, all of them give you a 10. So uh, 10 out of 10. Yeah. Any other comments or questions?
I heard about somebody that had sickle cell and I guess the pain was so bad they just died. Carol,
Mm.
you remember hearing about that story? Somebody had sickle cell and they just died because of it.
Well, sickle cell can be fatal. I mean, it's a disease that kills. Yeah, it's a lethal disease. Of course, now we have a treatment for it, but uh, when we were growing up, it was not treatable. It just treated the pain, hydrated and treated the pain. Now we have other treatments for them, even have transplant and genetic uh, treatments, which we can now cure it. But uh, people who have the sickle cell C disease that have SS uh, typically had painful crises every year and were often thought of as drug addicts because they had to have their pain medication. So, Darryl, you had a comment.
Yeah, AI overview says while both sickle cell disease and shingles can cause significant pain, sickle cell crises are generally considered to be more intense and debilitating than shingles pain.
Okay.
Okay, next article, please. Uh, Bill of Rights would emphasize people with cancer have a voice in their care. And this is something that they're suggesting. Uh, to me, that's something that should be available anyway. The fact that they should have a voice in their care and needing a patient's bill of rights is kind of a failure of our system because every disease should have a patient should have a voice, not only cancer. But anyway, there's no question that it's life changing and often life ending. And we're in an era now in which people survive from cancer, which is wonderful. But the fact that they should have a Bill of Rights is true for cancer and for every disease. And those patients who have had cancer and have had it treated probably can speak to this better than anybody else. Uh, um, but their voice should be heard. And the ability to get a second opinion is true for cancer as it is for every disease, which you're not responding to the treatment that's given. Second opinion becomes critical. So, Jacobed?
Yes, I have a question about most doctors' offices you go in, they give you this packet of information, especially when you're first visiting them. And they give you this packet of information. In it is all of this reading, and they want you to read it and sign it. And I'm a person who wants to read with understanding, and oftentimes I don't have time to do that in the doctor's office, uh, because they are on a target and for time, and so I don't like to sign anything that I don't understand, and it's hard to make a decision on, yes, I'll accept this information, and because I want to see the doctor about my problem. It, I don't know. So I mean, that's just an observation. It's not really anything that anybody can do anything about it, I don't think. But I can just imagine older people going into a doctor's office and they're handed this whole packet of stuff. Your Bill of Rights as a patient and your Bill of Rights as a doctor and all of that sort of thing.
Dr. Calder, you're muted.
Dr. Perez. Sorry, Dr.
And I
Perez.
think that's why your friend, Harold Friedman, uh, uh, instituted the navigators, because you need support. And in our community, you need support that's paid for, so that we have moved. And I hope, as you share with us what you have at your church, that we have people who go with you, because during many of those visits, you can't concentrate, especially if you're suspicious of a of malignant diagnosis. That's why we are our brother's keepers. And that's why this information that's shared every Thursday has got to be, that we receive here, has got to be shared with everybody that we know. And I hate to bring it up all the time. Like Cory Booker stood up. We have to stand up and go with each other. Go when you know that somebody is getting a diagnosis, because sometimes they can't hear. They can't hear. And we have to be there to ask the questions. And yes, no, don't sign anything. Ask to have the material sent to you prior, or have your advocate read it for you. So that's all I'm saying. God never intended for us to take this journey alone. We've got to accept the help, ask for the help, and be available to help.
Thank you for sharing those two very critical comments made by Jacobet and Dr. Perez are very timely and provocative. Any other comments? Carol?
I agree with Jock a bit, but that goes in every aspect of life. They give you all these forms. When you buying a house, buying a car, you buy any equipment, they have all this legalese, which is going to take you a whole day to digest. And you got to look it up on AI to understand what they're talking about. Then you got to have a lawyer. And why can't they just break it down? Even teaching, they have all this legalese, and most of the time I didn't know what it was because they're always coming up with something new, some acronym new, and nobody, like one time I asked the teacher what this department meant, they had something, CRI, something, and nobody in her department knew. But I think we do this even in medical field. They have you like smoking. Do you smoke? Or have you smoked? And they don't give you a time frame. And a lot of people, if they smoked when they were 10, 20 years ago or something, and I smoke now? No, it's not clear. A lot of the questions are not clear. Have you ever had or anything like that? So maybe, I don't know how you rectify this, but that's our whole society. They send you a credit card bill and then ask you to read all that fine print and acknowledge, and I give you my consent. Or if you want to buy something, and check this box after you read all this stuff. Do you understand? And all you want to do is just buy the stuff. So with what Jacobet said, that is one of those things in America that I don't like.
Thank you for sharing very much. Any other comments? Right on target. Probably something shared by all of us. We just haven't had the
I'm going to attend.
Okay, let's go to the next article unless there's any other comment. This is a criticism of the fact that lung cancer screening rates are 4 times lower than breast and colon cancers. And yet there are so many people who qualify for lung cancer screening. And since lung cancer is such a killer, it is important, therefore, to let everyone know that this is something that should be done, particularly in those who have ever smoked. We have so much emphasis on breast cancer and colon cancers, but we don't do as much for lung cancer screening. And it's something that we should try to change, especially now that we have this low-dose CAT scan screeners, which don't give you as much of the potential toxicity that the previous CAT scans did. And so the plea is to get more people who had a history of smoking in their lives to get this low CT screening to get an earlier diagnosis of lung cancer so it can be treated or removed. Any comment about this? Any of you? Darryl?
Yeah, I just looked up cancer rates, and I didn't realize that lung cancer was a leading cause of cancer death at 18.7%, followed by colorectal cancer at 9.3, liver cancer at 7.8, breast cancer at 6.9, and stomach cancer at 6.8.
Thank you for sharing. That's important to put into perspective that, and this may well be because it's diagnosed late. So we've got a long way to go to uh, deal with lung cancer. I had one of my best friends who died of lung cancer. By the time it was diagnosed, it was already spread. So an earlier diagnosis could have been associated with treatment.
I have a question, Dr. Callender.
Jochebed first and then John. Jochebed?
That's very true. My mother died of lung cancer, and although she was very happy about something was going to take her away, but uh, she worked in textiles. She never smoked, and but she worked in textiles, and um, she didn't. Well, periodically she had like what she called the deep cold. It would be mucus. She would get up, and but it wasn't diagnosed uh, until she was in the hospital because she couldn't get rid of the cough, and uh, they ran all kinds of tests, but finally the doctor diagnosed her with lung cancer, and by then it had metastasized, and she just went on her way. But when the doctor told her she had incurable lung cancer, she says, well, hallelujah, something's going to take me on the way. She was ready to die.
Mm.
But I thought it was really baffling for me that many doctors had seen her and none of them had thought in terms about uh, the possibility of lung cancer.
Thank you for sharing. John Buchanan, were you next?
I've always wondered, when you go to the dentist and you have x-rays, they put that heavy lead jacket on you to protect your lungs. I've always wondered, do x-rays themselves cause cancer?
Yes, yes. The developer of radiation also died of cancer. So yes, that's why they put the lead aprons because we know that that is toxic.
So would you think that would be a factor, a fear factor for people not getting lung x-rays?
No, because no, would I think that I would say no because the toxicity associated with just getting a chest X-ray would not be sufficient. But if you had to get many X-rays, it would be an issue.
Okay,
But for just one X-ray, it wouldn't be. But if you had to get 10 to 20 X-rays, and then that would be an issue.
thank you.
Any other comments or questions for this very important topic? Well, thank you very much. Next article, please. This is interesting comment about artificial intelligence, which we all agree is the future of medicine. And the working together of the physicians and AI is the best possible situation. AI is not intending to replace the physician, but is going to complement the physician. And the two together will be a force for curing many diseases and detecting early many diseases and seeing that they are treated the best way that they can. So the combination is what I think should be sought for. Combination working together of the physicians and the AI to give the patient the best shot at cure of whatever disease entity they may have. And this article pretty much is emphasizing that uh, to put them in direct opposition one to the other is not the way it should be. It should be that they're working together to optimize healthcare in all humans.
Yes, Dr. Calendar, this I think there's a link there, yeah, for video. So if you guys are able to do that at home, click on that video and it'll talk about the AI and the future of medicine. I was thinking about Star Trek, where uh, the doctor has this tricorder, and he could just scan you, and it would pick up all the illnesses or whatever that you have. But the doctor still has to make the final decision as to what to do with that information. So I'm thinking that this is an important part of the future of medicine now, right?
Thank you for sharing. Dr. Perez.
The fact that ending the decimation of the Board of Education, Department of Education, is going to put a significant hit, especially on HBCUs, in comparison, therefore alleviating or greatly diminishing the diversity that's needed to address many of the issues of AI. And so these two things happening at the same time is worrisome.
Well, in many ways, that's an understatement of the malignancy of the situation, because I think that in many ways it's genocidal, because it's killing off our black men. So my protestations are that it's even genocidal, and that they've done many things to decrease the input of black males, and this is just another nail in the coffin. Any other
Profound,
comments?
Dr. Calendar, profound.
Any other comments? Next article, please. This is an interesting article because it says physicians are enthusiastic, but patients are skeptical because they see what's happening. And if you have bad data in, you get bad data out. And if you have a system that's poisoned and is against diversity, how can you have AI that's going to be that helpful? And so the patients aren't as enthusiastic about it as the physicians are, because they don't have that faith in the system. And that's the issue, the distrust. And they have good reason to distrust. People of color have even more reason to distrust, with this current administration manifesting the fact that they no longer consider diversity as a strength, but as a weakness. It's something that is anti-human, and something that destroys whatever trust we may have had before. And so, because of that, their enthusiasm about AI is modified and altered. Any comment about any of you who recognize this situation?
Yeah, I've always wondered
Yes, John.
who who sets up AI.
Who sets up AI? AI is set up by a group of physicians and community people that look at the data and The positive aspect of it is before this administration, diversity was viewed as an important aspect of it. And for that reason, AI was thought to be trustworthy to some extent. With the new administration, which has eliminated as much as possible the importance of diversity, therefore, the data that goes into the AI will be skewed, and that is the source of discontent, and the reason why perhaps many communities are being skeptical about the role of AI.
So my question is who does that? Who determines what goes in? Is it the government or is it scientific or medical board?
No, as I said before, it was a combination before. Now, what will happen after we have decided that diversity is a non-issue means that the system will be poisoned and that the influence of diversity, which is critical, will be eliminated, which would mean that there's skepticism about what will happen in the future. In the past, as I mentioned, it was diversified, and there were people from community that were participating in AI and its use. This, as I say, with the new administration, where diversity is eliminated, this will not no longer happen. Tatum?
Yeah, I'm curious about something, Dr. Callender. How will AI and UNOS would would that be a value to UNOS, or would that be diametrically opposed to UNOS?
AI is already part of everything that we have. It's already part of it.
So it's helping.
It's long been part of it.
Yeah, so it's helping UNOS then.
Yeah.
Okay.
Darryl?
Yeah, there
It's
are.
helping UNOS as long as there's diversity.
Darryl is next. Darryl is next.
Okay. Yeah, John Buchanan was asking what exactly is AI or the sources for it. And it's not to be confused with the general AI assistants or the chat bots. You may have heard of Chat GPT or Gemini or Claude. Those are just the general AI assistants, but companies, universities, they build their own AI, which is just machine learning or deep learning. There's a lot of applications like Adobe products. They build their own AI. There's many products and many university research systems that build their own machine learning and deep learning artificial intelligence systems.
Yeah, I'll give you one example. They have, chess.com has their own AI system uh, for playing chess. And they have built machines that are very, very hard for humans to beat.
Dr. Perez?
I think the point was made. If we're not included, garbage in, garbage out. Just like drugs that were not used or studies that didn't include people of color, like UNOS, the things that you made UNOS do. If there isn't that diversity, if there isn't that voice, then the information is going to be garbage to us.
Janice, thank you for your comments. Janice?
Yes, with the AI being so popular now, we're speaking of it now in regard to medicine and health. Would it cause possibly the elimination of positions in the health arena, doctors, or how does that work?
Well, the article before this one pointed out that it's a combination of AI plus the physicians. That is the ultimate goal, where the physicians and AI will work together.
Okay.
Not the elimination of one or the other, but a synergism of the two together.
Okay, thank you.
There's something else
That's the
called,
dream. That was the dream anyway.
Mhm.
Now, how this will work out with the new administration remains to be seen.
That's the key.
there's
Yeah.
something called open source AI, which alludes to what Daryl's talking about. Each organization has their own system. Well, open source AI is the use of a variety of organizations and their AI applications together as one.
Well, the key point, though, is that uh, prior to this time, we had a system that felt that diversity was important. This new regimen regime believes that diversity should be eliminated. And when you eliminate diversity, you eliminate us, which means that things may be different. But prior to this administration, diversity was thought of as a positive force and something that was important. But now with this new administration, which is eliminating diversity, then you have to look at it very differently. Is my feeling on the matter. Any other thoughts or comments?
Everybody remembers the Rainbow Coalition. Well, that was built to pace upon diversity, and so now that would completely be eliminated. Don't want
You
the
said it.
want one
That's
color.
right. Right, white.
Yeah,
Uh, yeah.
at one end of the color spectrum, and the other end, the rest of the color spectrum is, done away with.
Ready for the next article? Yeah, Darryl, you had a comment.
Yeah, I believe some years ago we were talking about, uh, okay, we've got Howard University Hospital, for example. Um, they have research departments, but I understand because of the federal funding that they take, that while they can include diversity in their research, it has to be allocated by demographics. So, in other words, if they do research, if the white population is 60%, it has to have 60% Caucasian inputs, 17% Hispanic inputs, 14% Black inputs, but the diversity doesn't really specify that the research, is just people of color, and so it doesn't really specify. You can't focus on Black people, is what I'm trying to say. If you take government money, is that pretty much a fact?
Uh, it remains to be seen because uh, right now the battle is on with the White House saying one thing and Supreme Court saying something else, and so it remains to be seen what is really going to finally be accepted because uh, the way in which the NIH is going to be reformed, it now has about I forget how many institutes there are, but there's upwards of 20 institutes, which will be reduced to probably about 6 or 7 with the elimination of the Disparity Institute, which means that the impact of health disparities will be eliminated from research. And how this will act out in terms of the grants that are already approved really is not clear because uh, the essence of this new administration is that diversity is eliminated. And if that's the case, that means we're become uh, inessential, shall we say.
I'll give you
Uh,
a classic example of what you're saying. We had a recent air accident in the DC and Virginia area. And Trump said the reason we had that error was because of diversity.
Right. That's right. That's exactly, and so he's outlawing in many ways diversity, which is against us. Yeah. Dr. Perez?
This administration did respond very quickly to the stock exchange and, more importantly, the bond exchange. So it's always and will continue to be about money.
Sadly. Okay, I guess any more comments? If not, we move to the next article. Now, this is an article that is painless in the sense that they're just talking about the fact that in taking care of patients, it's important to have a broadly diversified group of people who take care of the patient. And it's amazing so that in every other area, diversity becomes a strength, but just for our administration, the diversity is a weakness. But this is emphasizing the importance of other people like the people who give you the exercise treatments, the nutrition, the other aspects, the other staff people who make up the whole organization. They become particularly important. We realize, for example, we talk about exercise. Well, if patients don't get exercise, and then they can't heal. And so it becomes important to have all members of the healthcare team to be part of the health equation. Uh, and so the one thing that is happening is that we're now recognizing that the other parts of the organization are equally important. And so we need to have nutritionists, we need to have physiatrists, and other staff that will broaden the horizons of what healthcare that the patients receive, not just the doctors and the nurses, but all the other components of healthcare delivery. And this is something that I think is long overdue in an appreciation of all of the aspects of healthcare delivery.
Dr. Calendar, that is so correct. I'm taking physical therapy, and now they have added occupational therapy. They're into the picture now.
Yeah, very true. Okay, if there's no comment, we move on to the next article. Snoring and lack of sleep may raise type 2 diabetes in women who have gestational diabetes. This is an issue, as you mentioned. Lack of sleep is an issue. When you get less than 8 hours of sleep at night, it's something that is not good for your health. And so the snoring is something that suggests a respiratory component to it, as well as lack of sleep, which increase the likelihood of cardiovascular disease as well as mortality. And so these are two components and these are the difference between the risk for type 2 diabetes, people who snore and those who never snore. So whether this is just data that exists or whether it's real still remains to be seen. But this is the direction that our scientists are taking us and suggesting that snoring is a sign of ill health and lack of sleep similarly.
Dr. Calendar, is HR heart rate?
I don't, where's HR? I don't know.
See this chart here?
Oh, here, HR. No, no, I don't think that's what it is. No, no, I don't know what. I think that is related to the
That's the
risk. I
hours
think it's the
per.
risk. Say again?
I think that's hours per snoring
Oh,
regularly.
that's what it is. Yeah, yeah, I think you're right. It's hours. Yeah, yeah, yeah. Well, that's what it says, how many hours they slept and whether they snored, how many days they experienced sleepiness. Yeah. Although this looks to me like what it is it's the risk of in other words, they had the risk should be 1.00 and what they have is 1.32, which means it's 30% higher. So it's this is the relative risk. That's what that is. That's what that number reflects. And when you have an HR of 1, that's that means 0, like, and anything above that is a relative risk. Right. And Darryl, you had a comment.
Yeah, this is an AI overview that says yes, regular sexual activity, especially when it leads to orgasm, can positively impact sleep by promoting relaxation and the release of hormones like oxytocin and prolactin, which can improve sleep quality and duration.
Thank you for sharing. Any other comments?
What does gestational mean?
Gestational means that when you're pregnant, that's what, when you gestational diabetes means you get diabetes when you're pregnant. That's what gestational means. Okay.
How common is that situation?
That's it. We are learning that if you get gestational diabetes, that you're likely later on to develop diabetes because it's usually just a temporary condition
Mhm.
that occurs while you're pregnant, but after you're pregnant, it goes away. But there's evidence now that even though it goes away, it may recur later on in your life. Dr. Perez?
I'm surprised that there was no more response about the fact that orgasm gives you better sleep and better health. I loved that tweet. Orgasm will improve your health. That's the most important thing I heard all morning.
Well, I thought it was a given. I thought it was a given. But anyway, okay. All right. I think this will be the last article, so let's uh, prepare for next week. Uh, thank you all for being here, and thank you for your support. Uh, my wife's celebration of life will be April the 25th at Asbury United Methodist Church, 11th and K Northwest, with the visitation at 10 and the services at 11.
We love you,
And
Dr. Calendar. And
thank you so
all
much.
of our arms are around you.
Thank you very much. Appreciate it. Okay. I need it. Okay. All right. Any other comments about uh, the session today, which was very interesting as we approach a new day of every day, almost not every week, but every day there's something new that the administration is putting upon us. So it's interesting to really uh, go day by day. And whether you're worried about your stocks or bonds or whatever, uh, uh, it really does require us to really have faith and to never give up in spite of efforts to take us what I think is the wrong direction. I think everything points to the fact that diversity is a strength, but our new administration is saying that diversity is a weakness. So that's antithetical, but that's who the country voted for. So that's what we got to deal with. So we just have to stay strong, keep the faith, and wait for our chance to get things to turn things around.